Hello everyone. I put together this presentation to give a brief overview about congenital hypothyroidism. So the thyroid is an organ located in the neck that functions primarily to produce hormones. Primary congenital hypothyroidism is when an infant is born with a thyroid that did not develop properly. In a majority of cases, the infant has a smaller than normal thyroid gland, or the thyroid is abnormally located, or they have no thyroid gland at all. These cases are usually not because they're inherited from parents, and there's a low chance that the affected children will pass it on to their offspring. In other cases, there is a normal appearing thyroid, however, it doesn't produce thyroid hormones like it should. This form of congenital hypothyroidism can be inherited from parents. And this disorder overall affects approximately 1 in 2,000 to 4,000 newborns every year. And for reasons that are still unknown, females can get congenital hypothyroidism more than twice as often as males. So most infants do not have symptoms of congenital hypothyroidism at birth, perhaps due to receiving some of their mother's thyroid hormone before they're delivered, although some cases may exhibit the following symptoms: puffy-looking face, enlarged or thick tongue, large soft spots in the skull, hoarse-sounding cry, distended abdomen with umbilical hernia, problems with feeding, difficulty swallowing, constipation, poor muscle tone, and jaundice. The thyroid hormone plays an important role in normal growth and development. So if this condition is left untreated, individuals will have delayed growth, mental disability. It can disrupt sexual development, cause anemia, low body temperature due to lack of metabolism regulation, heart failure, and in some cases, loss of hearing. So one cause of congenital hypothyroidism is a mutation of genes that are related to the thyroid development or to the production of thyroid hormones. One of these genes is TSHR, which is located on chromosome 14, and it plays a role in making receptors that bind to TSH, thyroid stimulating hormone. Another is the PAX8 gene located on chromosome 2, which plays a role in thyroid development and production of thyroid hormones. And another that I've selected is the DUOX2 gene, and this is located on chromosome 15 and is critical for producing an enzyme that's involved in producing thyroid hormones. So congenital hypothyroidism is typically inherited sporadically, meaning that there's no previous family history. It is usually an autosomal recessive condition, so both parents are carriers of the recessive mutated gene, but neither of them show signs or symptoms of the disorder. In some cases, congenital hypothyroidism can be caused by mutations of the genes that we just discussed, and when that is the case, the condition is actually inherited in an autosomal dominant pattern, meaning that only one parent needs to have a mutated gene in order to give it to their children. And this is a pedigree that I've created to demonstrate the autosomal recessive inheritance pattern. So you can see that here, a couple that is both carriers of the gene, neither one of them have the disorder, but they carry it. They can produce offspring that have the disorder. And then in the next generation, none of these offspring have the disorder, but they are carriers of it because this individual produced children with someone who is not a carrier. And then in the third generation here, you see that they produce an offspring with the disorder because the father is a carrier and the mother actually has congenital hypothyroidism. So all newborns are actually screened for this in the United States. It is usually done between 1 and 2 days after birth. The time delay is so that they can clear out any remaining thyroid hormone that may be in their system from their mother. So they get a better test when they wait a couple days. But it only requires a small blood sample, which is usually obtained by a heel prick, which is shown in the picture here. And this is sent to a screening laboratory, and they will test the sample for levels of thyroxine and thyroid stimulating hormone, which are both important hormones produced by the thyroid. And when the thyroxine levels are low, but thyroid stimulating hormone is high, the infant is positive, and then they do another test to confirm. And then if the second test confirms those results, then they're usually diagnosed with the disorder. So there are some options for genetic testing. Since congenital hypothyroidism is caused by some gene mutations, such as the PAX8 or TSHR or the DUOX2 that I previously talked about, and that can cause an autosomal dominant pattern of inheritance. Some individuals might choose to have genetic testing to see if they actually have one of these mutations, and then they can know the risk of passing it on to their children. So some of the genetic testing choices include deletion duplication analysis, sequence analysis of the entire coding region of DNA, detection of homozygosity, sequence analysis of select exons, and the one that I found was most common is a gene panel. So these three are examples of companies that do the genetic testing, and obviously the price can range anywhere from $890, $1,400 and up. And so the treatment for this disorder is a daily medication called levothyroxine, which acts to replace the missing thyroid hormones that the individual needs. The child will usually have blood work regularly so that they can monitor their levels of thyroxine and TSH throughout their life. A primary care physician will sometimes work closely with a pediatric endocrine specialist to adjust the dosages as the child grows and ages. And usually the child, when they have appropriate treatment given in a timely manner, will grow normally, have no restrictions. And here are my references. Thanks so much for watching.